understand and be able to cope with, especially when you are not well educated in this area. So you'll see that don't go to that person. Oh, you can't predict the behavior. Yes, because that is what they are going to. They themselves cannot predict their own behavior. So I want us to be clear on what bipolar is. And it also comes in two different forms. It comes with mania, which is extreme, and it also comes with hypo, which is low. So some people are at the high level 1 minute, and then at the other minute, they're at the low level. The depression is very mild, whereas depression in other type of bipolar is very extreme. So I want us to be clear on that. One thing I also want us to put into consideration is that it is a long life condition. It's a lifelong condition. That means there's no cure. You live with it for the rest of your life. So some people that I want to really understand, they think, oh, medication will resolve it, therapy will resolve it. Yes, it does help, but you cannot cure it. I'm going to go to that further on into the presentation. So the key point that I want us to take here regarding what is bipolar, it's a lifelong mental health condition. It has a low and high, and it's also very unpredictable, and it affects your mood swing. So mood, your feelings, how we feel about each other, how we feel about other people, things we do, those things comprises together. I understand, but that's what we are actually looking at when it comes to bipolar. So a lot of people really, they don't really understand what bipolar is. They say, oh, it's acting like a bipolar weather. 1 minute is sunny, 1 minute is deeper than that. So I want us to please pay attention to this presentation today, because it's very vital. We might be experiencing it, we might not know that we're experiencing it. Maybe some of the symptoms that I'm going to talk about now, you might say, oh, I'm experiencing this, so this is the situation that I'm in. Because a lot of people, go through situation, they really don't understand what is going on with them. Some of them might even feel like, oh, I'm inadequate, I'm not complete. No, it's much deeper. Some people can't even relate to themselves, try to accept their own condition. They become, they get into that denial state, like, oh, there's nothing wrong with me, I'm okay, I'm perfectly fine. Whereas they're hurting inside, with the way they are behaving. So some of the symptoms that an individual with bipolar will go through, and it depends also, because there's stages of it. So I'm going to talk about the stages. So let me first of all talk about the symptoms. What are the symptoms? There are different types of bipolar, because I commence of bipolar, but there's different types of bipolar. So in bipolar 1, the symptoms is usually last one episode, one manic episode. Manic, remember I said earlier, manic is extreme episode of depression, of anxiety, mood swing, extreme, whatever. Extreme, and come only withdraw totally. Let's go out on outing. The person might say, oh, I'm not in the mood. The person might become extremely agitated. The person, everything is just in extreme. Their mood would be up in the head, like they cannot cope with their work, they cannot cope with their friendship, they cannot cope with their relationship, they cannot cope at all. They become totally withdrawn. This is bipolar 1 disorder. The same things. So people experiencing it find it so difficult to engage with other people. They become totally disengaged. So I want us to really understand that it's different from different people. From high, and some people might start from low, and then it will become a reverse, and then everything will be like high, low, or low, high. So you can never predict that behavior in bipolar disorder 1. What triggers it is that they will have a period of psychosis. What do I mean by psychosis? I'm talking about bipolar 1 disorder now. Psychosis is when they become, they experience hallucinations. They will, for example, someone is trying to poison them, or someone wants to kill them. And people will be like, there's nothing wrong with this food. Oh, no. They will make it so real that if people are not aware of what is actually going on, they will believe their story. Like, oh, someone is trying to harm them. Someone is trying to do something bad to them, because everything is processing negatively in their brain. So their brain cannot differentiate the reality from reality. So this is a very severe issue for so many people, and they are still living with it, or they have not even come to terms to accept that this is what they're actually going through. Bipolar 2, on the other hand, is different, just a little bit slightly different from bipolar 1. Bipolar 2, the person will experience at least one major depressive episode. Depressive episode is when they become totally withdrawn. They can't eat, they can't sleep. Anything you call them, they won't get engaged in. They totally disengage themselves. They become totally depressed. They won't go to work. They don't want to see family. They don't want to see anybody. They will be wearing the same clothes every day. They will just abandon everything. They won't care at all for this about the consequences of it. We'll say it will come on, because the brain is not functioning well. It's not functioning well. It cannot differentiate the reality and non-reality. So they become extremely depressive. That is why they call it major depression. And it can only happen once in a lifetime, or several times within a lifetime, depending. To become to be considered a clinical bipolar, the symptom has to last at least 2 weeks, minimum of 2 weeks, that the same pattern of behavior is reoccurring every day for at least 2 weeks before any therapist or any doctors can say, oh, you're actually suffering from bipolar. Going further, bipolar 2 is not a milder form. No, it's not a milder form, but a separate diagnosis by itself. So if someone is diagnosed with bipolar 1 disorder, they can also be, another person might be diagnosed with bipolar 2 disorder. So it's not like, oh, bipolar is general for everybody. It's not general for everybody. There's different types. So in bipolar 2, the person experiences at least one major depressive episode, at least one hypomania. Hypomania is low. They will experience a hyper, and they will also experience a low, which is hypo. So that one is back and forth. They go back and forth. So bipolar 2 is very, very difficult to recognize, because you wouldn't be able to know which diagnosis am I going to give this individual, because they will sometimes present themselves as a low depressive individual or as a high depressive individual. So you get boxed up about, okay, which one do I want to diagnose do I want to give this individual when they are fluctuating back and forth. But like I said, it's deeper. I'm just giving us a very brief interface of it so that we'll be able to have at least a knowledge idea about what bipolar 2 is. Remember, it's a bit different from bipolar 1, and it's not the mildest one. So it's, hey, company, I want to diagnose, they gave them a diagnosis of bipolar 2. That doesn't mean it's lesser. No, it doesn't mean that the diagnosis is lesser. No, it absolutely doesn't mean that. It just means that it's a different types of bipolar disorder. That's a different type. The third one is the psychotymic. Psychotymic is another type of bipolar disorder. The disorder has three. It's like when they say bipolar is just the umbrella. Under that umbrella, there's subdivision. So under those subdivision is bipolar 2 and psychotymic disorder. So in this one, in the psychotymic disorder, the person at least experienced 2 years of many period of hypomania symptoms. 2 years. So that one is extremely difficult for doctors to diagnose, because the person has to experience it for 2 years, and you're allowed to go through that psychotymic disorder for 2 complete years. You know, behavior fluctuating from high to low. 1 minute they are cold, another minute they are hot, and they go through that back and forth. Then a period of silence. They don't even experience anything at all. That is why they call it psychotymic disorder, because it is so difficult to diagnose. Because disorder, for a complete 6 months, the symptoms doesn't show up at all. So they think, oh, I'm fine, it's just a normal part of growing up. Then it will show up again. It will go back. It's totally different from bipolar 2 and bipolar 1. Whereas those two surface constantly, but this one doesn't. It takes a period of at least 2 years for you to document. And how many of us will be documenting our behavior? None. So a lot of us are just going about our business without realizing that we do or are experiencing mental issue, because you have to be able to document how often this particular cyclotimic disorder, how often are you experiencing it. Get a journal just to today, me doing it, tomorrow I'm a little bit sad, what's going on? Things happens, and therefore that is why it's so difficult to actually give a proper diagnosis for cyclotimic disorder. I hope I'm very clear. If you have any question, please go ahead and ask me so that I can clarify the bipolar 1, bipolar 2, and cyclotimic disorder so that we don't get it all confused. Moving forward, another type, this particular one, I'm sure some of us have experienced it. It's called medication-induced or alcohol-induced bipolar. In this scenario, the doctor will prescribe a medication, probably a pain medication, that you think it might be innocent, and then you start taking it and you start feeling somehow like delusional, or you saying things while you are sleeping, or you say things that doesn't correlate with each other, without understanding that the medication side effect that you are taking is what is actually inducing that kind of behavior. And people don't really want to understand that, because majority of doctors in Nigeria, they will just prescribe a medication to you to go and take, maybe for painkiller or other issues that you might be going through, without actually telling you the side effect of that medications. Oh, okay, this is the side effect when you take it and you experience this. This is what you have to come back and tell us. They don't. They just prescribe the medication to you, and you start taking it, and then the medication become something that will affect your mental status. And people really don't understand. Baba yo ribai now, mama yo shibai lati bi jomi look on back on the sharing one. This is how we just find them. All of a sudden, they just start talking to themselves. They just start moving things around. They become restless. They don't do anything. And how many people will say, maybe when this person is taking medication? No, we won't. Our mind won't go directly to the medication, because we weren't given any information regarding the side effect or any interaction that we might be having with that medication. So that is why they call it medication-induced bipolar. So please, any medication you are taking, ask your doctor, or you yourself can even look for that medication on Google. Just type the medication name and ask for and search for side effect of that medication. Be your own healthcare provider when it comes to taking medication. Any medication your doctor give you, check it up on Google, and it will give you a list of side effects to look for. So when you are actually experiencing it, you will know that, oh, it's the medication that I'm taking that is causing this, not that I am mentally disturbed. So pay attention to the aspect, for those that are drinking, alcoholic, or they are taking drugs, they also can be affected by that drug and alcohol. When they get drunk, they start saying things, all kind of stuff. Their brain is not functioning well at that time. Mama that is absolutely not true. That is not true at all, because when the person is drunk, they cannot process anything whatsoever. So you might think what they're saying is right, but they are not. They're under the influence of alcohol. Therefore, their brain is not functioning well, and they will say things, they will do things that are abnormal. So please, let's pay attention to that as well. And if we do have someone beside us that is going through this issue, just, let's do our best to support that person so that they can live a better life. Another thing that I wanted to talk about is mania and hypo. Mania and hypo are two distinct episodes, but they have the same symptoms. What do I mean by that? Mania and hypo, they are the same in episode one the same, the same, but symptoms one is totally different. So how will actually identify one? Unless you are a doctor or you are in the medical field, you can easily identify. And sometimes it's difficult for us to even identify as well which one it is, unless we look at it for like 2 weeks and say, okay, well, this is what the person is actually going through. I will give you an example of mania and hypo and how they correlate with each other. They will have abnormal heartbeat. What do I mean by heartbeat? Heartbeat is when the person is not stable, physically not stable. Might jump around, watching one party, want to share another thing, one party. They will do one thing, they will leave it. They will do another thing, they will leave it. They will just be doing so many things. They will be, bombarding themselves with so many things to do. They will be dabbling in so many things, but guess what? They will not complete any one of them. They will not achieve anything from all of those things that they are dabbling in. It applies to both the bipolar 1, bipolar 2, and psychotamine. That is so difficult. This is a very difficult mental health disease that even the doctors are struggling to actually give appropriate diagnosis for the individual, because they all have the same symptoms, but the difference is how long did the symptom last and how often do you experience the symptoms. Another thing, that they will have increased activity, energy. They will become agitated. When they are experiencing it, whether the hypo or the mania, everything will just be the other way around. They won't be able to comprehend things. They'll become agitated. It's not something that it's worth screaming or shouting at. Why is the person acting so aggressive? They become so aggressive, and at times they will become so withdrawn. So the mania and the hypo is so difficult. I'm telling you, that it's so difficult to really understand. And another thing, they will have a decreased sleep. They won't be able to sleep at all. Their mind will just be processing. It will be so difficult for their mind to shut down, for their brain to shut down. That is why the mania and the hypo, remember, the mania is severe and the hypo is low. And they do surface in individuals with bipolar. They also have racing thoughts. What do I mean by racing thoughts? Racing thoughts is they will be thinking, processing so many things in their brain. They will just be thinking, processing. 50 years ago, they will bring it back and start processing it. What happened yesterday that they should just ignore, they will process it. They will replay everything in their mind again to look for where they did something wrong. They are always so judgmental of themselves. They always say they're inadequate. They always judge themselves negatively. They don't believe that they are good for themselves. Individual with bipolar, they process things totally negative, in their brain. And if anything happens to them, whether sickness, any downfall, they will process that thing that they won't find any solution to it within themselves, and they will be fighting themselves, blaming themselves, consistently blaming themselves. In both mania and hypo, it's in fact, unless you really are knowledgeable about the symptoms, that's the only way you can help this individual. And they will act like everything is fine. When you ask them, how are you doing? Oh, I'm fine, but deep down inside of them, they are not fine at all. They are struggling inside them, but they will present themselves as being okay to the family or to their loved one. Another thing is, some of them will become extremely talkative. I'm explaining the mania and the hypo, because some of us are mania, hypo. Well, these are the symptoms of both hypo and hypomania, and both mania. They'll become extremely distracted. Distracted. Like if you are saying something to them, they'll say, "Oh, I'm sorry, I didn't get that." And then you repeat it again. They will process it for a minute before they can actually give you a concrete answer, because their brain is far gone. Their brain is not there with them. Their brain is already is in another zone entirely. That when you are telling them something, they will, "I'm sorry, what did you say?" Because their brain is not within them. So they're not mindful of their surrounding. And I'm also going to teach us about mindfulness as well. They have poor decision making. Very poor decision making. These are the people that you will see from, they will be changing relationship back to back. They will get involved in a relationship now in another 3-4 months, they will find fault in the individual that they are having a relationship with, whether it's intimate relationship, whether it's personal relationship, friendship relationship. They will find any type of flaws just to get out of that relationship, and then they will leave, and then they will quickly get into another relationship, and then be in that relationship, and then all of a sudden they'll get out of that relationship. They will they build another relationship. They cannot hold a steady relationship, or they cannot be by themselves for a long period of time. They fear being alone. They totally fear being alone. Depending on the type of bipolar they are suffering with, the mania might be extreme or the mania might be low. So if you know someone that is diagnosed with bipolar, always ask them if they are close to you, because it's not something people like to talk about. Which type are you diagnosed with? The doctor should be able to give them the type, and once you know the type, you can even do your own research to learn if your partner is diagnosed with bipolar, to learn more about it, so that you can be able to support that individual, rather than letting them be like, this person has started again. It's always going up and down. What did I do? Why all this? Why all that? Don't let us look at it from that perspective. I want us to be able to understand it, be able to be a supportive person to the individual, that whether it's a friend or whether it's an intimate person, relationship that we're in. Let's be a supportive individual for that person. Another thing that I also want to talk about regarding the mania and the hypo, because I'm still coming to major depressive. So the mania and the hypo, they will make foolish investments. What do I mean by foolish investment? Well, when they're given an investment to do or something to get involved in, because they have a large sum of money, rather than for them to look for the pros and the cons, they will just put that money into that investment. They will not do a thorough research on that particular investment, look for the pros and cons, how it's going to benefit them. They will just quickly put their money into it, and before you know it, the business collapse. That is why they make a decision without thinking it through. They just do things out of the spur of the moment. They do things without thinking it through. They do it just like that, until the thing collapses in their face and they become totally depressive, which is where I'm going next. What is the major depressive episode? How do we identify it? I've already explained to us about the type mania and hypo, the difference between mania and hypo, how they are correlated with each other, and how they are distinct, episodes to look for. But now, what is major depressive? Major depressive episode includes symptoms that are severe enough to cause noticeable difficulties in day-to-day activities. I repeat, major depressive episode are episodes that include symptoms that are severe enough and noticeable. That is, if we are observing it, we will be able to see it. And he is such a happy person. What happened to this individual? This individual is such a happy person, is a jolly person. All of a sudden, he just becomes so depressed. What could have happened? Or maybe then we start putting our own opinion. We start giving them excuses when we shouldn't. We try to justify that behavior when we shouldn't. We should look at it from, wait a second, what's going on with this man? Especially if the loved one has passed on for a long time, maybe 2, 3, 4, 5 years, but the person just all of a sudden become depressive. And the reason they call it major depressive, because they become extremely depressive. The depressed moods, such as feeling sad, empty, they feel hopeless. Like this life is just hopeless for them. They call it major depressive, because they become suicidal. That is what sets it apart from the regular depression. Major depressive episode, the individual will become suicidal. What do I mean by suicidal? Is they will want to kill themselves. They will even have a master plan on how to kill themselves. They will concoct it and try to execute it. They will be going back and forth Should I do it? Should I not do it? Should I do it? Should I not? Remember, they are hearing voices in their head as well. Remember, I said earlier, they become hallucinated and also delusional. So they will be processing things in their head. They will be hearing voices in their head, and they will try to act based on that voices that they are hearing. They will have decreased ability to concentrate. They cannot concentrate on anything whatsoever. They won't do it. Some of them will abandon their work. Some of them will abandon their relationship. They won't become involved in that relationship any longer. They will just abandon it. They will walk out. You see some people where and the husband or the wife doesn't know why. This can be some of the reasons that the person is fighting a battle inside him or her that he or she cannot explain to the husband or to the family. All of a sudden, one can make an abrupt decision. One can pack, one can leave them. Same thing with their children too. They will just abandon the children. Oh, every Monday, I just want to be by myself. And then they will be by themselves for a period of time, and then they will experience this major depressive. In this major depressive, they will become extremely restless. They will have experience insomnia or sleeping too much. Insomnia is when you cannot sleep at all. Your brain cannot shut down. Your brain is constantly working. And then in another aspect, they will just sleep and sleep and sleep and sleep and sleep and sleep and sleep. That is major depressive. Like I said, it has its own high and it has its low. Another thing is some of them will lose weight during that period because they are not dieting. They are not on diet medication, but because they are not eating, they won't eat at all. They won't even drink. They won't eat at all. But they are not dieting because they become so depressive. They've already concocted a whole lot of things, negative things in their brain. Some of them will be drawing the map, talking to themselves, on should I do this, should I do that? If you see anybody that's doing that, please try to support that individual. Another thing is they will have fatigue. They will feel extremely tired, very sluggish, low energy. They won't have energy to do anything, even to take a shower. They can't do that. To brush their teeth, they can't do that. Láti wẹ̀ gan, iṣẹ́ ni. Láti fọyín wọn, wàhálà ni. Láti dìde pé káwọn lọ jẹun, káwọn lọ cook gan, iṣẹ́ ni. To even get up to go and cook is a problem for that individual. This is major depressive episode in bipolar disorder. They will even do things that abnormal. They will start taking their clothes off. They are not mindful of their surrounding. They will just start taking their clothes off, Well, even their underwears, they will strip themselves naked. And people will wonder like, just wrong with so and so. And people that are not in the medical field or health conscious, they won't be able to understand what is actually going on. How come I will need to? They will just be looking at the individual. What's wrong? And some people misinterpret it as, oh, he or she's trying to seduce me. That is the first thing. If it happens to a man, if a woman goes to a man's house just to say hello, or a casual friend, and the female individuals just start stripping their clothes, they will misinterpret it as, oh, he or she's trying to seduce me. Again, if it is a man that goes into a woman's house and sat for a minute and they see a trigger, it could be anything, and the person just starts stripping or walking around in their underwears, the woman might perceive it as, no. The person is not aware and mindful of their surrounding. They're not aware at all. They don't even, understand that they're doing that. Some of them in this particular situation, they will run out of the house. You just see them butt naked and you see them running around. That is just a myth. That is just a myth. Bipolar individual, once you see them like that, just bring them back in. They might fight you, only bind up, only become resistant to you. You can always bring them back. Within a couple of hours, couple of days, they will regain their senses back. A perfect example are those individuals roaming the streets in Nigeria. Majority of them are in this particular scenario. But because people are not caring for them, they don't know what to do with them. I know we want to sorrow. That is not the best fit place for that individual. It is not. They need a supportive environment so that the individual, the family member can take care of them. They can get better. And if you realize that this individual, if you ever come across anybody that has bipolar, they are highly intelligent individual. Majority of them are highly intelligent. They will say so many things that you won't believe. Lagbaja, they're smart. Okay. What happened to the individual? He's such a smart man. What happened? The person is suffering from bipolar. They can be supported. They can be supported. Moving forward, children also experience bipolar, but it's so difficult to identify the children's own because it could be part of growing up. And unless it occurs 2 weeks consecutively for 2 weeks, for 2 weeks, that is the only time the parents can say, oh, I need to take my child to go and see a doctor. And some doctors are not well equipped or knowledgeable about bipolar in children. So they will say, oh, am I worried? Don't worry about it. There's nothing wrong with your children. Just take your child home. It will be okay. Whereas the child is already showcasing a mental disorder, but the parents are not accepting it, or they are in denial that this is actually happening to their child. Another thing that I want to talk about is when to see a doctor. Remember, I gave you a scenario about an individual that will strip themselves naked, and when they strip themselves naked, they will run out. That is the time that you seek medical assistance. Just tell them exactly what happened. And please, I want to debunk this myth. Don't let them bite you. Don't let them bite you. When they bite you, that's it. It is absolutely, absolutely a lie. If a person that is suffering with bipolar bites you in the process of you trying to restrain them to get them medical help and they bite you, you're absolutely fine. Unless the person has other medical condition that they're fighting with or that they have, but you can't catch bipolar from bites. No, you can't. Not even from their blood, unless something else is in their blood, like any sexually transmitted diseases is in the blood, but you cannot catch bipolar from someone biting you or from someone touching you. If you're touching someone that has bipolar, our society is very, very prone and very good at judging people with mental illness. We shouldn't do that because we don't even know whether it runs in our family. Yes, but it's skip our generation. It can resurface in another generation of ours. Then what? How would we feel if someone is judging us or someone is trying to stigmatize us or marginalize us in that kind of scenario? It's not something we would like or enjoy ourselves. One thing I just want all of us to take away from this is that anytime you see anybody suffering from any type of mental illness, try to give them the best support that you can. Please try to do that. What are the risk factors? Risk factors only for the bipolar, biological differences. People with bipolar disorder appear to have physical changes in their brain. Remember I said that earlier, that in their brain, something is not connecting. Some kind of receptor is not connecting well, so that is why they behave the way they behave. Another thing that is genetic, like I said just now, bipolar is more common in people who have first degree. I mean, first degree is either your father, your mother, your siblings, your grandparents. Because if any of your grandparents has mental issues, remember our grandparents, nobody diagnosed them. They don't see doctors. They take herb and they feel like everything is fine. It's not until now that our generation is not asking questions. That generation, and when it's generation, because think about it in your family, it's in your family, it was just never diagnosed, it was never dealt with. So it goes from generation to generation, and it can skip a generation as well. So if your parents had it, there's a possibility you might not have it, but there's a possibility that it might show up in your children as well. Your children might end up having that same thing. So, I don't baba mireo, I don't mama mireo. This disease situation is one of the things that my grandparents used to have. I remember this, and you start reprocessing. You start thinking, reflecting about what you have seen or what you have saw when you are growing up. And so, oh, I've saw this also. This is what it is. So we need to pay attention to that as well. And if possible, if we still have parents alive, we can always ask them questions. Baba, if that situation occur in our children, then we can ask our parents if we still have them. Like once you are alive, like family, they might still recollect. They might be able to say, well, bye. So okay, then you can be able to connect the dots. Okay, it's not just something that is abnormal in your child or that is abnormal. And some people really know, they know this, they know their history, their family history, but they are in denial to accept it. They don't want to accept it that, oh, this thing is actually happening to me. A lot of people are in denial, and you need to come out and accept it so that you can get proper help. What are the complications that can accompany bipolar? Yes, there is a co-concurrent condition that can make bipolar more worse. And what are they? Anxiety disorder. If an individual is diagnosed with anxiety, it will make the bipolar disorder more worse. What do I mean more worse? Is the person will have it in a severity cases. Any compound with the co-concurrent anxiety. I think I discussed anxiety way back. Anxiety, the person won't be able to sit still. Come from one place to another. They have no patience at all. And what combined bipolar, the situation is going to be more worse for that individual. They can't cope at all because there's two things happening at the same time in their brain. That is why they call it co-concurrent. Another thing is eating disorder. There are some people out there that have eating disorder. They don't want to eat. They want to look slim. They complain that, oh, I'm getting fat. Whereas they are losing weight and they are not eating adequately. That's eating disorder. They're not eating adequately. They don't want to eat anything because they are afraid to get fat. So that person also will experience bipolar and anxiety. So combine all those two together, the person is in danger, and a whole lot of things will be processing in their mind. And they are so prone in this scenario when they have concurrent two things working at the same time. That is when the suicidal thought is very high. Individual with alcohol or drug problem, I want to talk about muti, drugs, street drugs, it makes the bipolar even worse, because they can be saying, oh, I'm seeing something, delusional, will be on the high every time they are seeing something, every time they are hearing voices, every time, every day, something is happening to them. They will be saying things that don't, that doesn't correlate with the present situation. They cannot differentiate reality from non-reality. So that is why they call it co-concurrent condition makes bipolar depression disorder worse. So unless the doctor or you take yourself to a doctor to get diagnosed for any of the co-concurrent condition, anxiety, eating disorder, ADHD, which is attention deficit hyperactive disorder, which also occur to adults, not only children. Children becomes adults. So if your child is diagnosed with ADHD and the person become an adult, that symptom is always going to follow them. So okay, so when adults do experience ADHD, alcohol or drug problem, adults experience it as well. And right now, our youth are in extreme danger of these street drugs and alcohol, and some of them even mix them together. And that is really, it's really bad when you mix alcohol and drugs together. You are not doing yourself any favor. You are just making things worse for yourself. How do you prevent it? Well, there are no way to prevent bipolar. Unfortunately, as it sounds, there is no way to prevent bipolar, but you can only manage it through medication and psychotherapy, where you talk about your feelings, what you're going through, and then the therapist will try to change your thoughts to positive. That is the only thing out there for individual with bipolar. There's nothing at all. There's no medication. There's no cure. It's something the individual has to live with for his or her rest of their life. So with that being said, at the end of the presentation, if anybody has any question, please feel free to ask me so that I can answer the question before the program is over. And thank you for having me to present. And I hope I'm able to explain. You are able to understand to the best of your knowledge and to the best of my knowledge as well. If you have any question, please feel free.
We'll come to that. Thank you very much, Alaja Nemotaraji Gambari. May Allah continue to increase wisdom, knowledge, and understanding. We have really enjoyed your session. And I know, I can even see some hands up here. A lot of people must have written some questions down. Inshallah, we'll come to that. Before we go any further, I would like to, inform our audience that the host for today's program is Princess Jamila MKO Abiola from NASFAT Los Angeles. We appreciate Princess Jamila and our people for being part of this program. Allah Azawajala will continue to be with you. When it's time, we are going to give you a few minutes to talk. And inshallah, after Alaja's presentation, after she must have taken the questions, we also have one of our imams here who is going to further enrich our knowledge on this topic and possibly from the spiritual or Islamic point of view. Is Imam Saeed Adekunle from NASFAT Dolphin Ikoyi Outreach. So may Allah continue to be with each and every one of us. Now, back to our lecturer. In fact, this is indeed an eye-opener. A lot of things, I'm able to put some things together, even at my own hand here. And I believe the same with our people there. So the issue of don't let it get into the market, so property what you're out here, so it's all a rules, it's all a need. I've come with a lie, that is good to know. So we should show love to the people that are, that are struggling with bipolar. We should support them. We should have consideration for them.
Absolutely.
May Allah subhanahu wa ta'ala continue to be with each and every one of us. The floor is now open for people who might have one question or the other. The first person I'm going to allow to talk is Alhaja Baderinwa. Alhaja, please unmute yourself and talk. You have the floor, Alhaja Baderinwa. We can also put our questions to the Alexandra in the Q&A section. We'll take them.
This is a very good presentation, and it's an eye opener to some of us, because we even have some friends around us who have this kind of behavioral attitude, and which we actually probably never will have understood that maybe this is the kind of thing they are going through. But may I just ask, if you have a friend who has this kind of symptom and is in and out, being good, nice today, and the other day she's probably keeps to herself, or doesn't want to speak with you, or does things in isolation, or in an uncalled for way. What should one do as a friend? And then, because as friends, there is I don't know the way one can put it, that do you want to seek medical attention and all that? I don't know. How should one deal with this kind of thing when you have a close relationship with the person that you notice some of this?
Thank you, ma'am.
Thank you so much for that question. That's a very excellent question that you brought up. First of all, if we have someone, or if it's someone close to us, a family member or anybody that is very close to us, is experiencing any of the symptoms that I've mentioned, the best way to support that individual, don't relent. Don't get angry. Don't say bad and say, I've called, she's not answering me. Don't get angry, because you don't know what is going on in that individual's mind. If the person lives far away from you, go and visit the individual. Even if they don't open the door for you, still go. Still go and wait. You have to be extremely patient. I know all of us cannot be me, but at the same time, it takes a lot of understanding, love, and patience, because they will know that you are at the door, but they might not want to open the door for you. Don't feel offended. Wait, but continuously send text message, because they will be reading it. Call them. They might not want to answer the call. Try to take time out of your busy time to check up on them, even leaving stuff by the door for them. One day they will open the door and take it. They will remember, but they just don't want to connect with anybody at that present moment. So my best suggestion and advice for you, Ma, is don't relent. Don't get upset. And don't feel as if though you are getting tired, because it can be tiring unless you love that individual. Just continue to give them that support. Call them, send them text message, send their husband, or if the person has a husband, tell your wife, I'm asking you. Some people, you go to their house, they will tell them, their house girl, tell them I'm not home. And you know the person is home. Don't feel offended, because they are not processing things way you and I support them is just to check up on them. When they are out of that scenario and they are back to their senses, now you can now talk to them. But when you want to talk to them, you have to be very, very strategic in the way and manner you present it. Don't go in there with I came to your house several times, you didn't open the door. You are triggering an anger. Just go in there. How are you doing? Don't even reflect back on the series of time you've gone there. Don't go, but don't reflect back to no, don't go there, because they know that you are coming. But if you ask that question, they will become defensive and their mood will change again. So that is when you see them in a very calm situation, that is to address the situation with them. Say, well, all right. Show concern. Don't ask why. That why question, you're trying to pry into their privacy. Don't ask why. Just say, oh, I'm just concerned about you. I hope you're okay. And the person, depending on their mood, they might say, oh, I was just going to slow. They might even come to tell you what you need to know without asking the why. But don't ask the why. Why aren't you opening your door? Why? No, don't ask the why, because they are not in that situation yet. So there's something we call strength perspective. You let the person start where they are. That is what strength perspective is. You let the person start where they are. The person might not be where they are ready to answer you all the series of questions that you wanted to ask. They are not there yet. They are not ready to answer them. But they are just there now for you to be there for them and support them without asking any question. And if you feel like, okay, if you can push a little bit and say, okay, Abi can also the doctor is the person, oh no, I'm not. If the person becomes resistant, you know the person is in denial. So don't even push further. But if I say, maybe that person is receptive to you. So that is the time that you take advantage of that. Okay, I'll come and get you tomorrow, then we can go together. Rather than, if the person becomes resistant, don't push further, because the person is not there yet. But if the person realizes that, oh, something is actually wrong with me, they will say, okay, no problem. You can come and pick me up tomorrow. Maybe we can go. But at the same time, put it in the back of your mind that you might get there tomorrow too. The person might change their mind. I hope I've answered your question.
Thank you very much. Thank you very much, Alaja Mota. Now, Alaja Falami, please. Unmute yourself and ask your question.
I was happy to see that you're going to present. I've tried to reach you so many times. I don't know. Now I see that you're very busy. May Allah continue to give you strength.
My number has changed now.
Okay. I want to congratulate you for a very good presentation. This is a very eye-opening topic for me. I have never heard of this thing, and I have heard of bipolar, but I have always thought of it as a different kind of thing. But now that I have listened to you, I understand it more, and I'm able to relate it and connect it to some of the people that I have been, that I know or that I'm in contact with. So my questions are going to be like on many levels. First, I want to ask: can this be hereditary?
Yes,
And
I've
this
answered that
condition,
earlier.
oh, okay. Then again, there's another thing that I want to say. Can it be brought about by trauma? Because I realized that there was one time that I was in contact with a little person, a young person, and they told me about him that, okay, he doesn't do anything anymore. He doesn't take his shower. He doesn't brush his teeth. He sits in the toilet all the time. He's this, is that. But at that time, his father had just passed on. And I was attributing that kind of a condition to perhaps the trauma of the loss of the dad or some kind of depressive state. But now that you say it the way you say it, that it's a condition that drags on and on, I don't know whether it's something that can be brought up by trauma or that is, I mean, I'm confused about that. And also how we can also help those people. Then I also have a friend who is quite aged. You know, we're not aged, but, you know, like in my age bracket, sort of. And she has a few health challenges, but most of the time she's like that, just like you're saying. Her moods are always swinging. And I'd attribute it to maybe the drugs or maybe some of those other things. How can we manage things like this? Things people that were not born with this kind of condition, but are experiencing extreme conditions like this, extreme symptoms like this. What can we do to help them? What can we do? How can we do? I mean, how can we go about it? People that have always had normal lives and have always lived very productive existence, and already all of a sudden they just start to behave in any form. You can't reach them. You talk to them, you try to like say nothing is wrong with you, you're okay, you're this, but it's just not getting through. So I'd like to have some idea of how we can, as a friend, not as a therapist
Thank
or
you
anything
very
like
much,
that, how we
Elijah.
can help them.
Thank you very
Yes.
much.
Thank you so much. This
Let's
is a
have
very
the other questions in the queue and please.
thank you so much, Elijah. And I'm going to answer all your questions in depth because there's a lot of things that are playing right now. First of all, I will react again, which is as well. If you can, if someone that is very close to you, you can collect the medication name. You can even send it to me. I will help you look for the side effect. It could be the side effect that is triggering the symptoms as well, combined with the menopause. And also the individual age. How active is the individual? Is the individual exercising regularly? Is she taking multivitamins? Are they doing being active? Those are the things that we need to look into before attributing any diagnosis to that particular person. I hope I'm clear on that one, Ma.
Thank you very much, Alaja. We can go on and on and on, but looking at the time, it's already past 6 o'clock, and we want to listen to our Imam Saeed Adekunle, to further enhance our knowledge regarding this topic. Jazakallah khairan, Alaja Animota Raji Gambari. The missioner will soon pray for you. Please stay around.
Okay.
Now, Imam Saeed Adekunle, please unmute yourself and talk to us.
Okay, أعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم. الحمد لله رب العالمين. We thank Allah subhanahu wa ta'ala for the opportunity. Wọ́n ní kémi ó sọ púpọ̀ nínú Yorùbá torí pé Alájà ti sọ ìbú púpọ̀. Kọ́lọ́n kó bá san Alájà Gàmbàrí lẹ́san. Wọ́n ti yànnàná ọ̀rọ̀ bipolar. Wọ́n ti yànnàná ẹ̀ púpọ̀. Bipolar dà bí kéèyàn ò jẹ́ olójú méjì. Ìyẹn lè rẹ́rìn ní ìsìn kó jẹ́ lẹ́sẹ̀kẹsẹ̀ náà ni ó tún máa sunkún. Tí ọ máa wò pé kí ló lè fà á, ẹni yìí ló yọ̀ mọ́ wa láìpẹ́ yìí yóò sì bẹ̀rẹ̀ sí ní tún kanra lẹ́sẹ̀kẹsẹ̀ láì ṣe pé bóyá a rí ẹ̀rí fún pé n tó lè fà á fún nìyí, kódà onítọ̀hún fúnra ẹ̀ lè máa mọ̀. Eléyìí jẹ́ issue kan tó yẹ pé gbogbo ayé èèyàn púpọ̀ ló tiẹ̀ wá ń kojú ẹ̀ sìn because of so many reasons that we have around the world, so many issues around us. Ó ń fà á tó pé ọ̀pọ̀lọpọ̀ gẹ́gẹ́ bí àwọn àlàyé tí Alájà ti ṣe fún wa, ó pọ̀ pé ọ̀pọ̀lọpọ̀ náà ni wọ́n ń jìn sínú ọ̀fìn yìí tó pé tá bá ní ká lọ tẹ̀sí ọpọlọ àwọn èèyàn gan nísìnyí, ẹni tí ọpọlọ ó fẹ́ máa ṣiṣẹ́ dáadáa yóò mọ níwọ̀n kọ́lọ́n kí yóò ṣàánú wa. Lórí ọ̀rọ̀ bipolar, she had told us so many things about what could cause bipolar disorder. N tó lè fà á, ó ṣàlàyé púpọ̀ fún wa. Àwọn tí ó wá jẹ́ solution wẹ́rẹ́wẹ́rẹ́ tó wà fún. Ànábì wa Muhammad sallallahu.
This meeting is being recorded.
Ọ̀rọ̀ yìí lénìí, gbogbo ẹnikẹ́ni tó bá jìn sí orí ọ̀rọ̀ bipolar disorder yìí, ó jẹ́ àsìkò kan tí wọ́n nílò àwọn èèyàn. Kì í ṣe àsìkò tí a lè fi wọ́n sílẹ̀ torí wípé àsìkò yìí gangan ló máa rọrùn fún wọn láti lè wípé káwọn èèyàn ó wà ní sàkání wọn. Ó máa rọrùn fún wọn láti lè get over whatsoever it is they are going through at that time. Tí wọ́n bá ń go through ẹ̀, bọ́n ṣe ń go through ẹ̀, táwa náà bá pa wọ́n tì, send message, make phone calls, make visitation, wàhálà ńlá ló máa padà jẹ́ sí wọn lọ́rùn. Ànábì wa Muhammad sallallahu alayhi wa sallam ó ní ó dáa púpọ̀ kéèyàn ò dá wà ju kó wà láwùjọ àwọn èèyàn bú lọ. It is better to be alone than to be in the midst of bad people, bad influences. Ó wá ní it is better to be in the midst of good people than to be alone. So kéèyàn tó wá dá wà yẹn kò tún dá tó kéèyàn ó wà láwùjọ àwọn èèyàn tí wọ́n máa ṣèyàn ní àǹfààní, tí wọ́n máa ràn yàn lọ́wọ́, tí wọ́n lè kún yàn lọ́wọ́ tí yàn bá wà nínú ìnira kan àbí míì. Gbogbo ẹni tó bá wá ń go through phase yìí, Al-Qur'ani ní kó má jákàn kúrò lórí wípé bóyá kò ní padà dá mọ́. I have some cases lọ́wọ́lọ́wọ́ báyìí tó ní nǹkan ṣe pẹ̀lú bipolar. Màá fún yín example ẹyọ kan. Ẹni ẹ ò sí ní Nàìjíríà lọ́wọ́lọ́wọ́ báyìí, Cairo ló wà. Àmọ́ ẹnìkan jí òtẹ̀. Ó dẹ̀ ti kó gbogbo ẹ̀mí ẹ̀ lórí ẹni yẹn púpọ̀. So there was a particular day mi kan post nǹkan kan lórí status mi lórí WhatsApp tó ní nǹkan ṣe pẹ̀lú depression, pẹ̀lú mental ill health àti nǹkan kan bẹ́ẹ̀ yẹn, that whosoever is going through any case of mental ill health should seek help before it gets out of hand. Gbogbo yẹn lèmi kàn ṣe. Ẹni tó wá mọ̀ tó mọ̀ pé ó mọ̀ nǹkan tó ń go through ẹ̀ ló fi jẹ́ pé a gbọ́dọ̀ máa béèrè ara wa ẹni yìí béèrè ẹ̀ dé level yẹn náà ló fi mọ̀ nítorí yẹn ń go through ló bá contact mi pé òun fẹ́ kẹ́nìkan bá mi sọ̀rọ̀ gbà tó wá bá mi sọ̀rọ̀ mo wá padà rí tí ẹni yìí ń lọ bó ṣe wá wà yẹn tó bá wà níbi iṣẹ́ àwọn tó ń ṣiṣẹ́ ká ràn àwọn èèyàn lọ́wọ́ nílé òun níṣẹ́ níbi tó wà lọ́hùn tó bá wà níbi iṣẹ́ nísìnyí ó kàn lè pariwo mọ́ àwọn ọmọ ọ̀gá á kàn pariwo mọ́ wọn òun náà ló tún máa tún fún wọn ice cream ló máa tún sáré yọ̀ mọ́ wọn ó ti wá ń di wàhálà sí lọ́rùn Ọlọ́run wá ní kóun náà tètè fura she now cried out pé problem tí kóun ń wò yìí kó má yẹ pé tó máa kó bá wọn lẹ́nu iṣẹ́ nìyẹn kó má yẹ pé tó máa kó bá wọn lẹ́nu iṣẹ́ nìyẹn so irú ẹni bẹ́ẹ̀ yẹn àwa ń follow wa ń bá a fa ọ̀rọ̀ therapy díẹ̀ bó tí mo fẹ́ fà yọ lórí ọ̀rọ̀ ẹ̀ ni pé tá a máa fi bọ́ sórí Islamic perspective ẹ̀ àwọn bipolar disorder àti every other ill health mental ill health tó wà pátápátá tá a bá rí ẹni tó bá ní kò ń ṣe gbogbo wọn náà ló kàn ní lásán majority of them or maybe I should say some of them ó nídìí kí wọ́n go through intanpe ní rukia Ànábì wa Muhammad sallallahu alayhi wa sallam ló recommend rukia yìí òun náà ni spiritual exorcism lọ́dọ̀ àwọn Christian wọ́n lè fẹ́ pè ní bóyá deliverance àbí kan bọ́ eléyìí nìkan ṣe pẹ̀lú àwọn àyà kódà ó ti fún wa ní àwọn àyà Quran àti àwọn àyà kan tó bá hadith wá tó yẹ pé wọ́n máa ń kà fúnra ẹni bẹ́ẹ̀ tó ṣe pé ara ẹ̀ máa padà wálẹ̀ kò ń ṣe gbogbo nǹkan náà ni àwọn there are a lot of therapy tá a bá sọ̀rọ̀ bipolar yìí sìn nínú àwọn therapy táwọn psychotherapists tó máa fẹ́ mú wá fún wa ní bóyá irú music therapy sìn ó ní ojú tí Islam fi wo music fún rẹ̀ tó yẹ pé music fún rẹ̀ tó bá lọ jẹ́ pé ẹ̀yin tó ń ṣe nìyẹn jinn bá ti lọ́wọ́ sí fúnra ẹni bẹ́ẹ̀ tẹ́ bá tún ṣe music therapy fún ó máa jẹ́ kó nira ni màá fún yín lápẹẹrẹ kan ẹnìkan bí sọ̀rọ̀ ó ń sọ fún mi pé ọ̀rẹ́ òun ni she happens to be a lady ó wá ń sọ fún mi pé ọ̀rẹ́ òun ni ó ń sọ pé ó masturbate ẹ má sọ pé mo kó lórí bipolar mo fẹ́ fi ṣe example fún yín ni ó sọ pé ó masturbate ó wá ń ṣàlàyé fún mi mo wá ń béèrè àwọn question kan ibi tó ti ń sọ mo fura pé ó dà pọ̀rọ̀ ara ẹ̀ ló ń sọ kò ṣọ̀rọ̀ rẹ̀ I started asking some personal questions that I was so sure that the friend wouldn't have shared with her nígbà tí mo wá bẹ̀rẹ̀ sí ní sọ ó wá ń fún mi lánsà mo tún tẹ̀síwájú ń fún mi lánsà mo ní wá kíkíní ìbá lè rọrùn fún wa ọ̀rọ̀ ara ẹ̀ là ń sọ kò ń ṣọ̀rọ̀ rẹ̀ ó lọ́rọ̀ ara òun ni that's fine nísìnyí láti kọ́kọ́ mọ̀ I asked so many questions then we started with the therapy tó lè ràn lọ́wọ́ bó bá ṣe ń ṣe tó ó máa gbìyànjú láti má ṣe but ó máa tún padà sí díẹ̀ mo wá padà fura wípé ó dà wípé ó ti lọ́wọ́ àlùjọ̀nú nínú ẹni yìí àwa padà organize rúkìá fún wallahi tallah a ṣe rúkìá fún ẹni náà àlùjọ̀nú tó wà lára ẹ̀ sọ̀rọ̀ ní tí mo sọ fún yín ò tí ju bí oṣù kan lọ before Ramadan just maybe a week or 2 weeks before Ramadan àlùjọ̀nú tó wà lára ẹ̀ sọ̀rọ̀ this lady is 27 years and that jinn ó ti wà lára ẹ̀ fún 17 years ó ní ìyàwó òun ni ó lóun ò lè kó lára ẹ̀ ó ní tóun bá ń bínú sí i ó ní wọn máa fọwọ́ tẹra ẹ̀ ní ó ní torí tí ò bá ti rọ́kùnrin pé tóun bá ti bínú sí i àlùjọ̀nú yẹn máa òun fúnra ẹ̀ mọ̀ pé àlùjọ̀nú máa ń bínú sí òun ó dẹ̀ ń bá sùn lójú oorun ó dẹ̀ ń bá ṣe gbogbo nǹkan bẹ́ẹ̀ yẹn mo fi yẹn ṣe example fún wa àwọn ẹlòmíín go through tá a mọ̀ sí bipolar torí pé àlùjọ̀nú máa strike lásìkò yẹn ló máa fi ṣẹlẹ̀ so ẹni tá a bá ti rí pé a ṣe àwọn therapy tí àwọn psychotherapists rú àwọn professional bíi Alhaja Gambari tí wọ́n bá ṣe fún tí ò bá ti ṣiṣẹ́ bá ṣe rò pé ẹ kó ṣiṣẹ́ ẹ jẹ́ kó lọ sọ́dọ̀ àwọn àfà tí wọ́n mọ̀ nípa rúkìá kò ń sọ̀rọ̀ wọ́n máa ṣe oògùn ẹni tó bá ní àlùjọ̀nú tó bá ń ṣe oògùn ó máa fún lágbára sí ni o wọ́n wá lọ ń rúbọ wọ́n wá lọ sídìí kinní kan náà ń di ẹrù ẹgbẹ́ ó máa fún lágbára sí ni o rúkìá ló lè yanjú ẹ̀ that is Ànábì wa Muhammad sallallahu alaihi wasallam ṣe fún wa nínú àdìsẹ́ kó ní likulli da'in dawa ó ní for every ailment there is a cure for every disease there is a cure tá a bá tí ì rí cure ẹ̀ òun la máa sọ pé àti ì rí cure ẹ̀ kò sí nǹkan náà tọ́lọ́run mú wá tí ò wá fi ìwòsàn sí. So for anybody that is going through any situation any issue whatever it is kó gbìyànjú láti seek help àwa tá a bá wá súnmọ́ ṣe mọ̀ pé àní mọ̀ téèyàn bá ń go through bipolar ńgbà míì tó wáyé pé àsìkò tẹ́yìn máa ń rìn sí lọ́dọ̀ ẹ̀ lásìkò tó bá jẹ́ pé negative side ẹ̀ ni bóyá anger for instance ní bipolar ẹ̀ tó pé táyìn tẹ́ lọ́dọ̀ ẹ̀ ló ń throw tantrums tó máa bínú gan tó máa la television tó máa ní tíyà òun bá wá láti sọ́mọ̀ kò wọ́n ní gbà ojú tẹ́yìn máa fi wò nìyẹn pé kò ń ṣèyàn dáadáa àwọn tó bá wà lásìkò ẹ̀ tó farabalẹ̀ tó ṣe gbogbo ẹ̀ wọ́n á tún máa fojú wò pé irú èèyàn wo leléyìí a lọ ṣe rúkìá fọmọ kan ní Kọ̀tún láìpẹ́ yìí náà ni ó ti dé level pé ó ti fẹ́ máa dàbí ìgbà tó ti ń ya wèrè, ó máa ń pe bàbá ẹ̀ lórúkọ ni. Nínú ilé wọn máa sọ fún wọn pé ọmọ àwọ̀ náà ìjọ yẹn báwa kan ṣe lẹ́bẹ̀ẹ́ ni ẹ̀yin náà mú wa ẹ máa wọ náà ni iná lẹ máa wọ̀ bẹ́ ṣe wà yìí. Ọ̀rọ̀ ẹ di pé àdìmú tá a dì gan tabẹ̀ sí ní pariwo kinní yẹn, ọ̀rọ̀ ẹ gba kún ó gbé lọ sí, ó ti kó level rúkì àjọ kan. So ẹ jọ tí mò ń sọ lórí ọ̀rọ̀ bipolar náà ni wípé gbogbo anybody tá a bá mọ̀ pé ó bá fall sínú irú situation yìí, ká má fi ilẹ̀, ẹ jẹ́ ká súnmọ́, ẹ jẹ́ ká wà pẹ̀lú ẹ̀, ẹ jẹ́ á máa bá jíròrò. Yóò dé àsìkò kan tó yẹ pé òun fúnra rẹ̀ ó máa ní òun ready fún intervention whatsoever tá a bá fẹ́ ṣe fún òun. Ká dẹ̀ jẹ́ ó mọ̀ yìí pé whatsoever tó bá ń go through látara ìgbára lọ́lọ́run, Al-Qur'an ni wa man yatawakkal 'ala Allah fahuwa hasbuhu. Ẹnikẹ́ni tó bá gbára lọ́lọ́run, ó lọ́lọ́run á tó. Allah will be sufficient for that person as long as he puts his reliance on Allah. Tí a bá ti lè fara ti Ọlọ́run, ó lọ́lọ́run máa tó irú ẹni bẹ́ẹ̀. Kò sí bó ṣe lè tó kó má fọkàn sí pé ṣọ́lọ́run dẹ̀ lè ràn òun lọ́wọ́ mọ́. Ẹnìkan ti dé level yìí pé ó lóun fẹ́ para òun nítorí pé kinní yẹn ti ń di ojútì fóun. Ó lóun fẹ́ para òun gbogbo ìgbà, ó máa ń ṣe bíi kó mú, ó ti already ní suicide intent, bíi kóun mú ọ̀bẹ, bíi kóun gún ara òun. Tó bá ti ń dé level yẹn, ẹ jẹ́ kí irú ẹni bẹ́ẹ̀ mọ̀ yìí pé kó má jákàn pọ́lọ́run lè ràn lọ́wọ́. La taqnatu min rahmatillah. Al-Qur'an ni ẹ má jákàn, do not despair in the mercy of Allah, in the help of Allah. Pọ́lọ́run yìí lè ràn lọ́wọ́, ó ní ẹ má jákàn bẹ́ẹ̀. So please let us seek help for anybody that is going through this situation, this issue. Tó bá ti di pé medical help or psychotherapy help tí ò bá ti ràn lọ́wọ́, ẹ jẹ́ ká seek the spiritual help fún, especially in the area of rukia. Pọ́lọ́run kó jọ nínú àánú ẹ̀ kó má ṣàkún ẹnì kọ̀ọ̀kan wa. Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum salam wa rahmatullahi wa barakatuh. The person needs to seek spiritual help. May Allah subhanahu wa ta'ala ease all our affairs. There is actually a question here, but I want to give 2 minutes to the sponsor of this program, the person that made it possible for us to be enjoying this lecture today. So after that, Alaja Nimota Raji Gambari, she's an in-house person, she won't mind. So she will respond to that question. So Princess Jamila MKO Abiola, you have the floor. 2 minutes, ma. Hello. Is Princess there? Unmute yourself and talk. Is she still here? Wow. We can't hear you, Princess. I can see you are trying to talk. Your mic is unmuted. Okay, while we're waiting for Princess MKO to join us, let me quickly read out the question and you'll be preparing your response to it. The question says, a boy who has been abusing drugs and has been in and out of the rehabilitation center is now diagnosed as suffering from bipolar. How can he get out of it? He has not really display any of those symptoms that you spoke about, but he is in denial that the drugs he's taking has any bad effect on him. How can he be helped? Please, before Alaja respond to that, in case you want to ask her further questions, you can talk to her on Facebook. On Nimota Care Foundation, she'll respond to your questions there. Now, Alaja, please respond while we're waiting for.
Can I correct you? It's on Nimota Raji. Nimota Raji. They can send Nimota Raji. Yeah, Nimota Raji.
Okay. Nimota Raji. Thank you very much. That's okay. Nimota Raji. Thank you very much. That's okay. Please respond to the question. 1 minute while we're waiting for our sponsor to join us.
If
I'm
I
already
understand
with you.
Oh, she's there.
Okay, hang on, Alaja Gambari. Say her now.
No, let Gambari speak. I will talk after her. Let her finish. Let her answer the question, please.
Allah will continue to honor you. Thank you.
Thank you so
Alaja
much.
Nimota, you have the floor.
Okay, if I understand what you are saying here is that the individual is abusing drug, and they are in and out of the hospital.
Yeah.
But the father is what?
that they said he's been diagnosed of bipolar. That is not displaying any of those symptoms that you spoke about, that somebody that has bipolar will have.
Okay, but the doctor already diagnosed with bipolar,
yeah?
right?
Exactly. That what can they do?
Okay. If you remember that I said earlier that bipolar has hypo and manic. The individual might be suffering from hypo, which is the low level bipolar, which they go in and out. So the person might not be on the severe level, but on the milder side of bipolar. So the only thing the parents can do is to continue to give him or her a support. If medication, because the medication, I really don't support medication because it makes them sleepy and it doesn't make them to be very active. So I will always recommend therapy for them. Cognitive behavioral therapy, talk therapy, narrative therapy, psychodynamic therapy, all those therapies are very good for bipolar. But the majority one, the most important one that we usually practice is narrative and cognitive behavioral therapy. If they can find a therapist that is well learned, seasoned therapist, they might be able to help the individual.
Thank you very much. God bless you. Princess, you have the floor now. Thank you.
Yes, thank you. Alhamdulillah, alhamdulillah, alhamdulillah. You've given me 2 minutes. Admin, please, can you unmute our chairman? I'm giving him 1 minute out of my 2 minutes. He's going to talk now before I talk. Please, it's AIS. Please, you can unmute him so that, because you did not unmute me before. I was hearing you. I was saying, you have to unmute me. So please unmute him so that you can talk now. Thank you so much.
Okay. You don't need to give him one minute out of your own. You can have his own 1 minute, no problem. What did you say is the name again?
AIS, that's what it says there.
It's been unmuted. Can you go on, please?
Okay, thank you.
Go ahead, please.
Assalamu alaikum wa rahmatullahi wa barakatuh. Alhamdulillah.
Wa alaikum salam wa barakatuh.
Wa salatu wa salam ala rasulillah wa ala alihi wa sahbihi ajma'in. I would like to thank both Laja Gambari and Imam, I believe, can't get his last name, but yes,
Imam Said Adekunle.
Yeah, Imam Adekunle, for both of their intrigue information about this very particular disorder. Actually, professionally, for the last 5 years, I've been working as a counselor myself, so I'm very familiar with the topic and some of the issues around it, and many of our cultural inclinations towards denial. Sometimes both the person who has been dealing with this condition and the family members may be in denial until a catastrophe happens when it's maybe too late. But I would like to focus my short comment on the point of Ruqya that Imam Adekunle mentioned. That's very, very important. However, before all that, Rasulullah sallallahu alaihi wasallam already gave us a preventive dua to make every day. No matter where we may find ourselves in this world, there is a jinn where you are. He or she may be living right there with you. So Rasulullah sallallahu alaihi wasallam said, every day after Fajr or Subhi prayer, read Qul Huwallahu Ahad 3 times, Qul A'udhu Birabbil Falaq 3 times, Qul A'udhu Birabbin Nas 3 times. After Dhuhr, read them one time. After Asr, one time. After Maghrib, three times. After Isha, three times. If we just do that, we can prevent a lot of these things from before it happens. Because there's no better solution than prevention. However, many of our people, they would rather burn candle or some other stuff that is not highly recommended by our beloved Prophet Muhammad sallallahu alaihi wasallam. However, on behalf of Nasfat Los Angeles, may Allah subhanahu wa ta'ala reward both of you and our moderator abundantly, and mostly the sponsor of this event. is needed in our community, both in the United States and many other places, and especially Nigeria, where people think everybody is wary. A person may not be wary, or even get close to it before they start labeling him or her with that. May Allah subhanahu wa ta'ala allow all of us to save ourselves from these things before it happens to us or anybody who is beloved to us. Jazakumullahu khairan. Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum salam wa rahmatullahi wa barakatuh. Thank you very much. And thank you very much, Princess, for allowing our chairman to talk. We really benefit a lot from his short speech. Bismillah, Princess. Thank you.
Alhamdulillah, alhamdulillah. First of all, I want to thank the organizers of this program. They've been doing it. Thank you so much. And I want to thank my sister, Ajia Nimata Raji Gambari. Thank you so much. That was very insightful, educative. We are familiar with this, and everything you've been saying, we're in agree to it because we're familiar with that. So thank you so much for your time. And Imam Adekunle as well, thank you. And I especially want to thank our NASFAT Los Angeles members because they are on. I can see all of them. Thank you for attending on a short notice, and all my guests that I invited, that I told today, I just sent the messages to them today. So thank you for joining. Thank you for giving us your time. Thank you so much. I really appreciate you honoring my invitation for joining. Thank you so much. Thank you so much. May Allah bless all of us. May Allah subhanahu wa ta'ala accept all our ibadah as acts of ibadah, all the things we do, everything we're doing in the cause of Islam. May Allah subhanahu wa ta'ala accept it from all of us. Thank you so much again. Thank you. I don't want to mention him. I see all of you. Please, thank you so much. Thank you, thank you, thank you. Masalam.
Thank you very much, Princess Jamila. May Allah continue to be with you. May Allah continue to reward you immensely for all that you do. Now, the directioner is here. We have Imam Salahuddin Olagunju. We're going to pray for our lecturer. We're going to pray for our own Imam Said. Especially our sponsors, Jamila MKO Abiola. She's the sponsor of today's program. May Allah continue to be with her. Please pray for her. And I can see some stakeholders, some members of National Executive Council, the chairman Ramadan Committee here too. Please pray for everyone that may Allah subhanahu wa ta'ala accept the little efforts everyone is putting into the Deen Islam as act of ibadah. Bismillah.
Bismillahir Rahmanir Rahim. On behalf of our chief missioner, I would like to say Jazakumullahu khairan to our lecturer, Al-Aja Nimatallahi Raji Gambari, and our Imam, Imam Said Adekunle, for the knowledge imparted on us. May Allah continue to increase both of you in knowledge. May Allah continue to strengthen you. La hawla wa la quwwata illa billahi al-aliyyil azim. For our sponsor, Princess Jamila MKO Abiola, may Allah count this, add this to the scale of good deed in the day of Qiyamah. May Allah reward you abundantly. Everybody, you have made this possible for us today. Many people are watching this through Zoom, through Facebook, and through YouTube. May Allah continue to bless you. And every one of us that has participated in this to this program, may Allah accept it from us as an act of ibadah. As recommended by the chief missioner, he said that after every program we should be reciting Surah Al-Fatih. We quickly do that now. May Allah grant all our requests. الله الرحمن الرحيم إن فتحنا لك فتحا مبينا ليغفرك الله ما تقدم من ذنبك وما تأخر ويتم نعمته عليك ويهديك صراطا مستقيما وينصرك الله نصرا عزيزا والذي أنزل السكينة في قلوبهم ولله جنود السماوات والأرض وكان الله عليما عزيزا يريد المؤمن عند الله فوزا عظيما ويعذب المنافقين والمنافقات والمشركات يدعون بالحسنى السيئة عليهم دائرة السوء وغضب الله عليهم ولعنهم وأعد إن أرسلناك شاهدا ونذيرا إن الذين يبايعونك إنما يبايعون الله يد الله فوق أيديهم فمن نكث فإنما ينكث على نفسه ومن أوفى بما عهد عليه وجعل لك الغلط من الرب جعلنا أموالنا وأهلنا فاستغفرنا ويقولون لرسولنا ما ليس في قلوبهم قل فمن يقولكم من الله إن أراد بكم ضرا أراد بكم نفعا بل كان الله بما تعملون خبيرا بل ظننت أن لا ينقلب الرسول والمؤمنون إلى أهلهم أبدا وزين ذلك بقلوب وزنة السيء وكنتم قوما بورا أما لا يؤمن بالله ورسوله فإن أعتدنا للكافرين سعيرا ولله ملك السماوات والأرض يكتب ما يشاء ويعطي ما يشاء وكان الله غفورا رحيما سيكون وكلفنا إذا انقلبتم إلى مغانم لتأخذوا أجرا لن تتبعوا يريدون أن يبدلوا كلام الله قل لا تتبعوا إلا قليلا قل للمخالفين العرب ستدعون إلى قوم أولي يعز شديد ولا يسلمون وإن تطيعوا يؤتي الله أجرا حسنا وإن تتولوا كما توليتم من قبل ليذوقكم عذابا أليما ليس على الأعمى حرج ولا على الأعرج ولا على المريض حرج ومن يطع الله ورسوله يدخله جنة تجري من تحتها الأنهار ومن يتولى يعذبه عذابا أليما لقد رضي الله عن المؤمنين إذ على سكنة عليه فأصابهم فتحا قريبا ومغانما كثيرة يأخذونها وكان الله عزيزا حكيما وعدكم الله مغانما كثيرة تأخذونها فأجل لكم هذه وكف أيدي الناس عنكم ولتكون آية من هداكم صراطا مستقيما وأخرى لم تقدروا عليها وبدأت الله بها وكان الله على كل شيء قديرا ولو قتلكم الذين كفروا لولوا الأدبار ثم لا يجدون وليا ولا نصيرا سنة الله التي قد خلت من قبل ولن تجد لسنة الله تبديلا ووالدك فايدا عنكم وايدا عنه بذنب وكتما بعد أسفرك عليه وكان الله بما تعملون بصيرا هم الذين كفروا وصدوكم عن المسجد الحرام ولأدين ما كفر يبلغ ما إله ولا رجال مؤمنون ينساهم مؤمنات منهم مهارات علمي يدخل الله في رحمته ما يشاء ولا تسأل الله من الذين كفروا منهم عذابا أليما إذ جعل الذين كفروا في قلوبهم الهميات الجاهلية رسوله وعلى المؤمنين وظلمهم كلمة تعالى وكان الله بكل شيء عليما لقد صدق الله رسوله الرؤيا بالحق لتدخلن المسجد الحرام إن شاء الله آمنين مالكين رؤوسكم ومقصرين لا تخافون فعلم ما لم تعلموا فجعل من دون ذلك فتحا قريبا هو الذي أرسل رسوله بالهدى الحق وكفى بالله شهيدا محمد رسول الله محمد رسول الله محمد رسول الله والذين معه أشهداء على الكفار وما بينهم تراهم ركعا سجدا يبتغون فضلا من الله ورضوانا سيماهم في وجوههم من آثار السجود ذلك مثلهم في التوراة ومثلهم في الإنجيل كزرع أخرج شطأه فآزره فاستغلظ فاستوى على سوقه يعجب الزراع ليغيظ بهم الكفار وعد الله الذين آمنوا وعملوا الصالحات منهم مغفرة وأجرا عظيما ولا حول ولا قوة إلا بالله لا حول ولا قوة إلا بالله العلي العظيم ولا حول ولا قوة إلا بالله العلي العظيم. Let's set our intention. So we do the Khutbah. Bismillah ar-Rahman ar-Rahim. Allahumma la sala illa ma jaltahu salan wala soba illa ma jaltahu soban fajal lana salan salan fajal soba salan wala tajal sala soba ya rabbal alamin. Allah laka shay'un wa anta al-akhir laysa laka shay'un أنت الذي أمرتنا فأجب لنا كما وعدتنا إنك لا تخلف الميعاد اللهم إنا نسألك عيشة هنية خير الوعي وخير النجاح وخير العلم وخير العمل وخير الثواب وخير النور وخير الحياة وخير الممات وثبتنا وسكت خيراتنا واكثر عطياتنا ونسألك الأولى من الجنة آمين اللهم إنا نسألك موجبات رحمتك وعزائم مغفرتك والسلامة من كل إثم والغنيمة من كل بر والفوز بالجنة
Hello, Imam, you are done. I can't hear
صلوا على
anything from your
النبي
end again.
الكريم
Sallallahu alayhi wa sallam. Allahumma salli ala Muhammad wa ala ali Muhammad. Thank you all very much for being part of today's program. Normally, the program is from 5 to 6:30, and as you can see, it's already 6:36. So, inshallah, may Allah subhanahu wa ta'ala continue to be with each and every one of us. Tomorrow is another edition of today's program. So, we hope to see you all tomorrow, inshallah. Wassalamu alaikum wa rahmatullahi wa barakatuh. Our lecturer, thank you very much. Our host, and our be on YouTube. Thank you all very much. Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum salam wa rahmatullahi wa barakatuh. Thank you for having me.
Thank you, Ajia. How are you?
I'm fine.
The recording has stopped.
And thank you for sponsoring the program. May Almighty Allah bless every one of us.
Alhamdulillah. Thank you for your time. I want Canada in Bangkok. And everybody.
Alhamdulillah. They are fine. We'll talk privately.
Okay, all right. Then. Take care, all right?
You too. Bye-bye, ma. Bye-bye, sir. Thank you so much for joining. Have a beautiful weekend. Thank you, ma.